When it comes to holiday gifting, I want to give people things they really love. That's why I'm going with Quince. From Mongolian cashmere sweaters to Italian wool coats, everything is premium quality without the premium price tag. I recently ordered the Mongolian cashmere V-neck sweater as a gift for myself, and it's absolutely gorgeous. The cashmere feels incredible. It's soft, but it's also structured. It doesn't pill. It's just a gorgeous sweater. It's basically the kind of quality I would expect from a $200 sweater, but this one is only $50. Quince has something for everyone on your list. Soft Mongolian cashmere sweaters starting at just $50 that look and feel like designer pieces. Silk tops and skirts for dressing up, perfectly cut denim for everyday wear, and outerwear that keeps you stylishly warm and cozy. Every piece is made with premium materials from ethical, trusted factories and priced far below what other luxury brands charge. Find gifts so good you'll want to keep them with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Let's be honest, we both know a shift starts long before you even step foot on your unit. What you wear sets the tone for your entire day or night, and that's why I genuinely love Figs. Figs makes scrubs for modern medicine. Back in nursing school, I was handed those boxy, scratchy scrubs that basically felt like wearing a paper bag. Figs has changed everything. They're flattering, so comfortable, and actually made for people who work in healthcare. Imagine that. Plus, they're antimicrobial to help keep you protected. They're durable enough for wash after wash and look so good, you actually want to wear them. I mean, I've definitely even worn mine, maybe not even to work, just saying. With the holidays right around the corner, it's a perfect time to treat yourself to some fresh looks for the new year, which is great because Figs just dropped a ton of new limited edition colors and styles for the season. From scrubs to accessories to footwear, Figs has a little something for every awesome human. If you want to check them out, Figs is offering 15% off your first purchase at wearfigs.com with the code FIGSRX. That's wearfigs.com, code FIGSRX. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. Before we hop into the episode, let's take a quick minute for a shout out. And this shout out goes out to Mickey, who purchased the Ultimate Nursing School Thrive Guide, my new book, as a gift for a nursing student. And here's what they said. I purchased this book for a friend's daughter who is about to start nursing school, and she absolutely loves it. She told me it's been incredibly helpful for easing her nerves and giving her insider tips she can start using right away. As far as gifts go, I am pretty sure I nailed it with this one. So thank you, Mickey, for thinking of me and my Ultimate Nursing School Thrive Guide as a resource for someone you care about that's going through nursing school. So the Ultimate Nursing School Thrive Guide is my new book. I released it, I want to say July, August, very recently, and it is available on Amazon in paperback, hardback, and as a Kindle ebook. And maybe someday I will record myself reading it and make it an audiobook as well. We'll see. All right, are you ready to dive into this episode? Today we are talking about cardiac stress tests. So cardiac stress testing is a not super invasive way, and you'll see why I say that in just a minute, but more or less it's considered non-invasive, and it is a way to evaluate cardiac health. And in its most simple terms, the test stresses the heart and measures how well it performs under pressure. With this test, cardiologists can assess things like cardiac function, coronary perfusion, which is a big reason for the test, exercise tolerance, and viability of the myocardium. So, some indications for a cardiac stress test, it would be utilized in patients basically with a wide range of cardiac conditions or symptoms. So, some common indications include detection of coronary artery disease, that is a big one, or detection of wall motion abnormalities. Also, looking at patients who have angina, who have shortness of breath, and it's not really because of a lung issue, we could do a stress test and find out what's going on with their heart. Stress tests are also utilized to evaluate risk in patients who are undergoing cardiovascular surgery or who have cardiac symptoms prior to undergoing surgery of any type. So, a lot of times, like let's say you've got your patient, Bob, he has a history of heart disease or what have you, some kind of cardiac issue, but he needs to come in and get his knee fixed, knee replaced. So, they may do a cardiac stress test just to see how risky this procedure would be for Bob. Now, another reason for a cardiac stress test could be in a patient who is severely deconditioned. They may undergo a cardiac stress test to determine their exercise tolerance. In addition, cardiac stress testing may be used to monitor patients with known cardiac disease. For the most part, the biggest reason you're going to see it used is to detect coronary artery disease. And there are two types of cardiac stress tests. There's a pharmacologic test and there's an exercise test. So, the least invasive or non invasive method is through physical activity or that exercise test. And we're going to use that whenever possible. However, not everybody is capable of exercising or a good candidate for that kind of test, and then they would undergo pharmacologic testing instead. So let's talk about each type of cardiac stress test. And we're just going to go over the broad strokes so that you have a general idea in case you come across this in the clinical setting or if you're a student, if you come across it on an exam. So let's first start with exercise stress test. Now, you may often hear this called a treadmill stress test, and that's because a treadmill is most commonly used, though I did see that bicycles may be utilized as well. But if you hear someone say treadmill test or treadmill stress test, that's what they're referring to, this exercise stress test. And what this test does is it monitors the patient's symptoms, their blood pressure, their heart rate, and their EKG while they are walking or maybe even jogging on a treadmill. Now, in most cases, what is used is something called the Bruce protocol, and this involves utilizing 3-minute stages of increasingly faster and steeper treadmill inclines for a total of about 6 to 12 minutes. Now, mild symptoms without hemodynamic compromise don't generally necessitate terminating the test, but if the patient experiences significant manifestations of cardiac dysfunction or anything worrisome, then the test would be terminated. So that could be things like moderate to severe angina, sustained ventricular tachycardia, if they've got some ST elevation, or if their blood pressure drops more than, say, 10 millimeters of mercury from baseline, along with some other signs of cardiac ischemia, like maybe they have that angina, or maybe they have poor skin signs. So, speaking of skin signs, that would be another reason you might be concerned. So, pallor, cyanosis, things like that. And then neurological manifestations. If the patient gets dizzy, if they feel like they're going to pass out or have ataxia, those would be indications that we probably need to terminate this test. And then, kind of in that gray area of do we continue? Do we stop the test? Might be any QRS or ST changes. Of course, that's going to depend on how significant they are and if the patient's exhibiting any symptoms. Any cardiac arrhythmias like PVCs or supraventricular tachycardia or conduction deficits, such as a bundle branch block or something like that, might be an indication for terminating the test. Significant shortness of breath. If the patient's wheezing, they're obviously having some respiratory difficulty there. If their chest pain is just increasing and increasing, or let's say they have hypertension beyond what's expected. So, of course, you're exercising, you do expect your blood pressure to go up, but if it goes up really high, like over 250 systolic or 115 diastolic, we need to stop. We probably need to stop this, right? And then there's also, if the flip side of that, the blood pressure decreasing. So, a decrease of more than 10 millimeters of mercury from baseline without any signs of ischemia would be a maybe we should stop this. So, those would be kind of your possible reasons for terminating the test. So, for a patient who is having a normal response to exercise stress testing, that heart rate's going to go up, that blood pressure is going to go up, but it's going to go up appropriately in response to exercise. In addition, a normal response would be no changes on the EKG, no signs of ischemia, things like angina or neurological symptoms or pallor, poor skin signs, all of that. If any of those things occur, then we are looking at potential problems with the heart. And very specifically, a positive stress test is present if the patient is having some specific ST segment changes. I'm not going to go into what they all are. That's for the cardiologist to figure out, but that's what they're looking for. And that is showing that there is ischemia happening in the heart. Have you ever had one of those seasons where the burnout just creeps in and then completely takes over? For me, it was a few years into my nursing career. I was taking care of everyone but myself. I knew that therapy could help, but finding someone who took my insurance felt impossible. That's why I love Rula, Rula. It's a healthcare company that makes mental health care actually accessible. They partner with over 100 insurance plans, so the average copay is just $15, sometimes even less, depending on your benefits. And unlike other platforms that match you with whoever's next in the queue, Rula considers your goals, your background, your preferences. You get a curated list of in-network therapists who are actually a good fit for you. And you can even get an appointment as soon as tomorrow. Thousands of people are already using Rula to get affordable, high-quality therapy that's actually covered by insurance. Visit rula.com/nursemo to get started. After you sign up, you'll be asked how you heard about them. Please support the show and let them know I sent you. That's rula.com/nursemo. You deserve mental health care that works with you, not against your budget.
Toast the holidays in a new way and raise a glass of rum chata. A delicious creamy blend of horchata with rum. Enjoy it over ice or in your coffee. Rum chata, your holiday cocktails just got sweeter. Tap or click the banner for more. Drink responsibly. Caribbean rum with real dairy cream, natural and artificial flavors. Alcohol 13.75% by volume, 27.5 proof. Copyright 2025 Agave Loco Brands, Pewaukee, Wisconsin. All rights reserved.
All right, so now let's move on to pharmacologic stress testing. So for patients that can't or shouldn't exercise, stress on the heart is induced with medication. This could include individuals with mobility issues, patients who have really high blood pressure, like over 200 millimeters of mercury. Exercise could be dangerous for them. Patients with unstable angina, we don't want to do anything to push them over into a more dangerous condition. Patients with poorly controlled heart failure or aortic stenosis or a recent myocardial infarction, and patients with things like pulmonary hypertension and acute respiratory or cardiac issues like a pulmonary embolism or pericarditis or something like that. So for the most part, if your patient can and should be able to exercise, they're probably going to be doing that treadmill or that exercise stress test. Otherwise, they're going to be doing a pharmacologic test. In addition, pharmacologic testing is more beneficial in patients who have certain cardiac conditions that involve an abnormal EKG at baseline. And that would be your patient who has like Wolff-Parkinson-White syndrome or a known left bundle branch block or left ventricular hypertrophy. They're going to get more definitive results with a pharmacologic test. So during the procedure, the patient's heart rate, blood pressure, and EKG tracing are closely monitored. And we're also going to be looking at the heart visually. we're going to induce stress on the heart by injecting a pharmacologic agent through a peripheral IV. So the patient will need IV for this. And this is followed by the injection of a small amount of radioactive material called a radiotracer or radioactive tracer. And this allows for visualization using a specialized camera, and you can see blood flow through that coronary vasculature. So we're monitoring heart rate, blood pressure, EKG, but we're also looking through this special camera to follow that radioactive tracer to see how blood is flowing through the coronary vasculature. So medications used for cardiac stress testing include 3 key medications that dilate coronary blood vessels. Now, these are adenosine, regadenoson, and dipyridamole. Now, there is one other pharmacologic agent that may be utilized, and that is dobutamine, and that is an inotropic medication. So those vasodilating agents work by inducing something called coronary steal. And this occurs when blood flow to non-diseased coronary vessels is temporarily increased, while flow to diseased vessels is reduced, making that disparity easier to visualize and identify coronary artery disease. So we're stealing from the diseased coronary vessels and pushing that blood over into the healthy vessels. So that's how those vasodilating agents work. And then again, dobutamine, that is a different type of medication that is an inotropic medication that you could see utilized, though it is not very common. And we're going to talk about each one of these medications. So first we have adenosine. So for cardiac stress testing, adenosine is typically administered as an infusion for 6 minutes, and it is a weight-based dose. So they get that infusion for 6 minutes, and that radioactive agent is given right in the middle, like right around that 3-minute mark. Patients getting adenosine can expect a mild increase in heart rate and a slight decrease in blood pressure. Side effects include things like flushing, maybe some shortness of breath, maybe chest pain, but it's generally considered minor or mild. However, it is possible to have more serious adverse effects such as bronchospasm or an AV block. Now, the next medication is regadenoson. So regadenoson is pretty cool, and this is the one that you will probably see most likely these days. And this medication produces maximal blood flow in the coronary arteries quickly and maintains it for that optimal duration. Some other key benefits of regadenoson is that it is a simple injection rather than a slower infusion, and it is not weight-based like the other vasodilating medications. Once given, that radiotracer is injected about 10 to 20 seconds later. And the cool thing about regadenoson is that studies show it is as effective as adenosine for diagnostic purposes, but it's safer and better tolerated. However, patients can still have some side effects. The most commonly reported are pain in the arm, the back, or the jaw, nausea, sweating, chest tightness, and chest discomfort. So that's regadenoson, probably the most common that you will see used. And the other vasodilating agent is dipyridamole. This medication also dilates those coronary vessels, and it works by increasing adenosine levels in the body. So it's an indirect vasodilator. It is administered over 4 minutes, and like adenosine, it is also weight-based. So it's given over 4 minutes, and that radioactive tracer is injected 3 to 5 minutes after the infusion is complete. Note that because dipyridamole has a longer half-life than other medications, the effects can linger up to about 25 minutes. Minor side effects of this medication include dizziness, nausea, headache, flushing, and hypotension. More significant adverse effects include chest pain and AV block, though the incidence of heart block is less with dipyridamole than it is with adenosine. So those are your 3 key vasodilating agents that are going to get in there and vasodilate those coronary arteries: adenosine, regadenoson, and dipyridamole. Now, dobutamine is the other medication that I mentioned, and dobutamine is different. It is an inotrope. And what inotropes do is they increase the contractile force of the heart. And dobutamine also increases heart rate. So, what we're doing with dobutamine is we are increasing myocardial workload. We're making that heart work harder. By doing so, we're increasing myocardial oxygen demand. And what this does is it leads to ischemia in areas of the heart that don't receive adequate blood flow due to coronary artery disease. And we're not trying to induce so much ischemia that we cause an infarction, but we do want to see that those areas are visualized so that we know, hey, this patient does have coronary artery disease. Let's try to work on that. So, dobutamine is administered as a weight-based infusion, and it's administered over 3 minutes and then increased in dosage at 3-minute intervals to a max duration of 12 minutes or until that desired heart rate is achieved. Now, the radiotracer is injected when the heart rate is at that peak, and the dobutamine is stopped about 1 minute later. Dobutamine is, again, not commonly used and is generally only going to be given in cases where the patient is not able to take those vasodilating medications, and that might be a patient with COPD or asthma or a high degree AV block. So you've gotten a bit of an overview of cardiac stress testing. We've looked at the exercise stress testing. We've looked at the pharmacologic testing. So now let's talk a little bit about education for our patients. So some key things to teach our patients prior to their cardiac stress test include, for starters, if they're undergoing a pharmacologic test, they need to avoid caffeine for 24 hours prior to the test, and that includes decaffeinated tea and coffee because those include a little bit of caffeine as well. It also includes things like chocolate, which has caffeine in it. So you want them to avoid caffeine, and that is because caffeine is going to potentially interfere, not potentially, definitely interfere with those vasodilating medications. In fact, if the effects after this stress test, if the effects of the medication are lingering and the patient's not feeling it, they can drink some caffeine and it should mitigate those effects when they are getting those vasodilating medications like adenosine or regadenoson. They also may want the patient to avoid eating, drinking, or smoking prior to the test, and the time frame could vary on that. It could be like 3-4 hours or so. Now, if the patient does have diabetes, they should definitely be speaking to their cardiologist, their ordering physician, whoever is determined they need this test for specific instructions regarding dietary intake. Now, if the patient's using a treadmill, I know it seems obvious, but make sure they know to wear athletic shoes and clothing that is appropriate for exercise, not showing up in your cute dress with your stilettos after work. You're going to be wearing something comfortable to move around in. Obviously, no one-piece outfits, like you wouldn't want to wear a romper. Is that what they're called? A romper or a jumpsuit or anything like that. And not like a dress, because that would be a one-piece outfit as well. And then again, athletic shoes. If they're not going to be put into a patient gown, then they want to be wearing a shirt that is loose-fitting, short-sleeved, and free of metal. And they should avoid use of creams, oils, powders, and lotions on the chest and arms for the 24 hours prior to the test. This is just going to help those electrodes stick more effectively and get a better reading. And then some medications may need to be avoided the day of the test, and they really should be discussing with their physician their medications. They don't want to stop taking anything unless their physician tells them to, but there are some that may need to be not taken, and it's really going to be up to them discussing it with their physician. And that's going to be especially important with things like beta blockers, nitrates like nitroglycerin, diuretics, and again, our patients with diabetes, we want to make sure that they're safe for this exam. So I hope that helped you have a better understanding of cardiac stress testing. I do have a lot of episodes that cover cardiac topics. Just go to the straight-a-nursing-student.com website, and then if you just type in cardiac in the search bar or cardiac playlist, I do have a playlist for cardiac, then you will see all kinds of episodes covering this very, very interesting topic. I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Doug. Here we have the Limu Emu in its natural habitat, helping people customize their car insurance and save hundreds with Liberty Mutual. Fascinating. It's accompanied by his natural ally, Doug.
Limu? Is that guy with the binoculars watching us?
Cut the camera. They see us.
Only pay for what you need at libertymutual.com.
Liberty, 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 liberty.
Savings vary. Underwritten by Liberty Mutual Insurance Company and affiliates. Excludes Massachusetts.